Okay, we'll get started now. Again, thank you so much for taking the time out of your schedule to come to our event. My name is Aaditi. I've been an outreach and engagement intern at neolth since February. neolth is a digital mental health company that aims to provide personalized care and support for students and youth. So for today, um, July is National Minority Mental Health Awareness Month. So today we're going to be kind of discussing minority mental health, specifically youth minority mental health, and discuss how community and belonging impact mental health for different racial and ethnic minority communities, and ways that we can mitigate these barriers, what we can do, as well as what youth minorities can also do for themselves. Feel free to unmute yourselves and to ask questions, ask comments throughout the presentation. I want this event to be interactive. Yeah, and we'll have a little bit of a discussion portion at the end as well. Yeah. Okay, so National Minority Mental Health Awareness Month. So it is in July. It was first declared in 2008. And every year, this month is a time to understand and reflect on the unique challenges that different minority groups, such as people of color, members of the LGBT community, face when it comes to mental health, illnesses, and treatment. So it aims to bring attention to mental health challenges faced by different racial and ethnic minority communities. It also helps promote awareness, understanding, and support for individuals within these groups, as well as seeks to reduce stigma, improve access to mental health care, and address cultural barriers. So with that, it also helps challenge the stigma surrounding mental health within minority communities, as different racial minority groups are more likely to experience risk factors that can cause such mental health disorders. So specifically, the Substance Abuse and Mental Health Services Administration, they reported that racial and ethnic minority individuals are less likely to have access to mental health services compared to non-Hispanic white individuals. And racial and ethnic minorities are more likely to receive lower quality mental health care and are less likely to receive evidence-based treatments, as reported by the Agency of Healthcare Research and Quality. So this is just a brief intro of or introduction of what we will be discussing throughout the event. Okay, so here I've listed some overall general challenges that minority communities may face. So these challenges are often rooted in systematic inequalities, social disparities, and cultural factors that contribute to additional stressors and behavioral for individuals with minority backgrounds. So some of these concepts do overlap with what we will be discussing in a little bit. So first is discrimination and racism. So we'll also be talking about that in a little bit in more detail. But discrimination and racism can lead to feelings of anger, frustration, and helplessness, which can negatively impact mental well-being. Also, the constant exposure to prejudice, kind of like making or being made fun of maybe the way you're dressing or like the food that you're eating. This can result in chronic stress and anxiety. This also can relate also to cultural identity struggles. So this is another big challenge that minority communities do face. So this is struggling with cultural identity and navigating between multiple cultural contexts can lead to feelings of confusion, identity crisis, which can affect self-esteem and mental well-being. Another is lack of representation. So underrepresentation of minorities in media, leadership positions, and educational curriculum can lead to a lack of positive role models and reinforce feelings of marginalization. Another big one, which we'll also be discussing a little more later, is family and community pressures. So within families, there are cultural norms and expectations just within minority communities that could differ from what you believe in or what you want to do with your life. So this can create additional stress and conflict as individuals may struggle to balance traditional values with their personal aspirations. So I feel like it is common for a lot of people within racial and ethnic minority communities to have to think about what I want to do versus what my family believes is right. Another big one is the stigma around mental health. So we're also going to be talking about this in a little bit, but stigma surrounding mental health in certain minority communities, they may prevent individuals from seeking help or discussing their mental health struggles openly. Stigma also does relate to, I guess, family and community pressures in a way, but does relate to like cultural barriers and family dynamics. And another big one is healthcare disparities. So this just talks about, or this mentions the lack of access that a lot of minority communities face in terms of mental health care. And then another is trauma and violence. So this is definitely prominent in different minority communities. They may have faced different traumatic events. So it's important with this challenge to implement trauma-informed approaches to address the impact of violence and trauma on youth mental health and providing different support services to these groups in general. So racial, ethnic, gender, and sexual minorities often suffer from poor mental health outcomes due to multiple factors, including inaccessibility of high quality mental health care services, cultural stigma surrounding mental health care, discrimination, and overall lack of awareness about mental health. Okay. Okay, so now I'm going to touch base on a few overall, I guess, concepts within minority mental health that I think are important to kind of focus on. So one of them is stigma. So stigma surrounding mental health is prevalent across various racial, ethnic, and cultural backgrounds. Stigma can be a significant barrier to seeking and receiving mental health support, leading to delays in seeking help and inhibiting the use of mental health services. So here I've just listed different ways that like stigma is kind of induced in a way, or how stigma leads to not doing certain things or kind of like biases. So generational beliefs. This is stigma that is related to mental health that is passed down through generations within minority families and communities, perpetuating attitudes that hinder open discussions about mental health. And then cultural stigma. So cultural stigma, this refers to how in some minority communities, mental health issues are stigmatized due to cultural beliefs and attitudes. Um, Also, these kind of all intertwine in a way, but they're just different, I guess, terms relating to stigma. Um, so Mental health problems may be viewed as a sign of weakness or spiritual issues, leading to reluctance in discussing or seeking help for mental health concerns. Um, and then intersectional stigma. So this refers to individuals who belong to multiple minority groups who may face intersectional stigma, which combines the stigma associated with both their racial or ethnic background and their other marginalized identities, whether it's LGBTQ plus status, disability, etc. Another is lack of representation. Mentioned this with the challenges, but in terms of stigma, so it's similar how the underrepresentation of different minority groups and mental health discussions can increase stigma and contribute to feelings of invisibility. So lack of representation may not look like an issue in terms of stigma, or that something that increases stigma, but having people that look like us or who represent us that openly can talk about mental health limits, I guess, may increase our voice in the matter. So having somebody who does represent us, I think, is really important in terms of mental health amongst different minority communities. Another is impact of systematic racism. So this is kind of broad, but systematic racism and discrimination can contribute to stigma surrounding mental health in minority communities. So historical injustices and discrimination within mental health systems can foster mistrust within the health systems, kind of like the physicians and stigma. So that might make individuals of different minority groups kind of not seek help when they need it. Um, yeah. And then the last one here is reluctance to seek help. So this kind of refers to like the impact of systematic racism, but the reluctance to seek help. Um, it overall, I think, is a huge outcome of stigma within like minority mental health, just in general as well, just stigma in general. But unable to seek help. So that is referring to due to fear of judgment or discrimination. Some individuals from minority backgrounds may be less likely to seek professional mental health support, choosing instead to rely on informal support systems. Um, which can only exacerbate mental health symptoms. So overall, stigma surrounding mental health issues can lead to feelings of shame and embarrassment, causing minority youths to conceal their struggles and avoid seeking help. Alongside that, internalized stigma can cause individuals to perceive their mental health issues as personal weaknesses, leading to negative impact on self-esteem and self-worth, as well as that can definitely exacerbate mental health symptoms. Okay, and then another concept that we'll be talking about is cultural barriers and family dynamics. So, cultural factors can determine how much support someone gets from their family and community when it comes to mental health. Because of existing stigma, minorities are sometimes left to find mental health treatment and support alone because of um, kind of the stigma that a lot of like families have within minority communities, just because um, we mentioned just generational beliefs. So if like your family members or your parents, they didn't really talk about their feelings, they didn't really openly talk about mental health, then that can kind of um, lead to having to find external support, or just feeling worse because you don't have your family to kind of listen to how you're feeling. So here, cultural norms in racial minority communities may view mental health issues differently, or discourage open discussions about mental health concerns. And then with family expectations and cultural values, they may discourage open expressions of vulnerability or mental struggle. So it kind of ties in. So with family dynamics, we mentioned family and community pressures. So this is similar in terms of cultural expectations within the family and community may impact the decisions of minority youths regarding seeking mental health support. So there is a pressure to conform to those cultural norms, which can deter them from reaching out for help. So stigma, the cultural barriers, family dynamics, they definitely intertwine to leading minority youths to not reaching out for help or seeking help. And then family expectations and pressure to succeed and do well can create further stress and anxiety for minority youths. We'll be talking about that in a little bit specific. But in terms of the first point of being able to or having to find mental health treatment and support alone. So this refers to kind of the lack of culturally relevant resources. So minority youths may struggle to find mental health resources that align with their cultural background and needs, which makes it a little harder to access culturally appropriate care. And additionally, family dynamics, they can influence how mental health is perceived and addressed within minority household. So I've mentioned it before, but if kind of the stigma, like the generational beliefs, if the stigma is kind of passed down, then that might make you less likely to address your mental health, or to realize, oh yeah, this is not normal, I should reach out to somebody. So definitely all intertwine. So overall, the combination of stigma, cultural barriers, and family dynamics can result in the underutilization of mental health services by minority youths, delaying or preventing them from receiving the support that they need. This in turn can exacerbate mental health conditions and lead to more severe and chronic issues over time. And then now what we're going to talk a little bit more about racism and discrimination. So racism and discrimination can have profound and lasting impacts on the mental health of minority youths. So racism is a mental health issue because racism causes trauma. Mention how trauma and violence is like one of the challenges for different minority communities. And racism is one of the ways that people kind of experience this. So, and trauma, it's directly linked to mental illnesses, which need to be taken seriously. So here I have there's some overlaps that we've mentioned before, but I think a really important one is talking about identity and cultural struggles. I feel like it's very common, like when you are experiencing racism or discrimination towards like maybe wearing your cultural outfits or kind of speaking your language. It can definitely make you feel like, oh, I'm not wanted. Oh, I want to look like them, which I think is very common within youths for sure and students. But minority youths, they may face identity struggles as they grapple with questions of belonging and cultural identity in the face of discrimination. So this can contribute to psychological distress. Also, racism and discrimination can create conflicts relating to identity and belonging. So a lot of individuals may grapple with questions about their place in society, cultural identity, and acceptance. leading to further distress or just an identity crisis in a way. So this somewhat aligns or is similar to internalization of stereotypes, um, which this refers to being constantly exposed to racial stereotypes and discrimination, such as, I don't know, there's a lot. I will not mention some. Which can lead to internalizing negative beliefs about oneself and one's racial or ethnic group, affecting self-perception and mental well-being. Yeah, I feel like these are definitely common within youth minority individuals. Um, so somehow being able to combat that in how we support different minority groups is important, as I think these are very relevant, and they definitely come up. Another is academic and behavioral difficulties. So the stress of racism and discrimination can adversely affect academic performance and behavior, leading to lower achievement, engagement in school, and decreased motivation. Additionally, if one experiences a lot of discrimination in school in particular, then it may kind of not make you want to go to school. And that takes a toll on your academics. Um, yeah, in a way, it can be a whole cycle. Um, okay, so we have social isolation. So minority youths who experience racism and discrimination may withdraw from social interactions to protect themselves, which can lead to feelings of loneliness, not being able to talk to people um, just about what's going on or what you experienced. And then it can also lead to low self esteem and self worth. So, frequent encounters with racism, discrimination can negatively impact self esteem and self worth, leading to feelings of inadequacy or unworthiness. So, these are all different concepts, but kind of when all tied together, they may not make you feel that great. So, it is essential that we validate the experiences of minority youths, provide support, and work towards dismantling systematic racism and discrimination to foster mental well-being and resilience in these communities. Okay, so now we're going to specifically talk about barriers related to mental health care for different ethnic and racial minorities or minority communities. Right, so with barriers to medical access and mental health services. So this access can be limited by lack of insurance coverage, um, as well as there may be limited availability of culturally competent care, lack of awareness about available resources, as well as financial constraints. So more than half of uninsured US residents are people of color. So that shows how, I guess, insurance coverage, access to mental health care is definitely disproportionate. Um, and then, with provider discrimination. So, this refers to kind of the provider, the physician, um, kind of making stereotypes or kind of not putting individuals of minority communities first. So although provider discrimination and microaggressions can be subtle, um, there are big implications. So there have been studies that have documented how physicians were less likely to identify the severity of depression among minority patients versus white patients. Um, Often, a clinician with the false assumption that mental health needs are less prevalent among minorities may be less likely to recommend treatment in comparison to a white patient with similar symptoms. Um, so we have to keep these studies kind of in mind, that racism is not only a civil rights issue, but also a public health concern. And that discrimination, it does impact the level of care that different ethnic and racial minority communities do face. So it's part of, and this refers to different cultural beliefs about mental illness. So that relates to stigma within different families and different minority communities. But regardless of even that stigma, there is still lack of access based off of what I've just mentioned. And then, so low perceived need. So this refers to kind of members of different minority communities may not feel they need different or need mental health care or services, or felt that they could handle the problem without treatment. So this is obviously tied to stigma and different cultural beliefs. Societal stigma, I think, keeps minorities from seeking needed mental health care. So the barriers, it does relate to kind of unaccessibility, that issue, as well as stigma. Um, so, so specifically with youth minority mental health. Okay, so our cultural background can affect how we cope with stress and adversity. In some cultures, it is more acceptable to express emotions openly, while in others, in different racial and ethnic minority communities, um, emotional restraint is the norm, meaning it's not that common to talk about um, kind of your feelings and how you're doing and all that stuff. Um, so this can affect how we cope with stressful situations and how well we bounce back from setbacks. So this refers to kind of resilience, and that it can be a little challenging to do so if there is still the stigma, or there are different cultural norms that you have to follow through on, especially with high academic pressures and different stresses that us students kind of face. This adds on to it. With family culture, so I've mentioned here, there's some positive aspects where family can give a strong support system or a sense of identity, but family culture can also create challenges and barriers to seeking help. Um, so Cultural norms, family expectations, and community pressures can impact the mental health of youth minorities, influencing their decision-making processes. Um, so that's why kind of family dynamics, like whether your family is your support system, can definitely, I'd say, like make or break your mental health in a way, um, especially within youth minority mental health. And then here, there's also academic pressure and stress, which I just mentioned. So minority youth may face additional academic pressures and stress due to cultural expectations and the desire to succeed in a competitive environment. Does anyone have any questions, comments? Before I move on. I will move on. Okay, so here I've listed different steps that youth minorities themselves can take for themselves. Um, So the first one is cultivate cultural pride. So this basically talks about embracing and celebrating your cultural identity. It might help to engage in different activities that connect you to your heritage, maybe learn the language, make some friends that are within your cultural background, um, which can help build a sense of cultural pride. Another is seeking community and peer support, um, as well. Oh yeah, as well as, oh wait, never mind. So I think it's really important to reach out to trusted friends, family members, mentors, to talk about your feelings and experiences. Sharing your emotions can definitely help reduce stress and provide emotional support, especially if you weren't able to do that beforehand. Um, it's definitely a lot easier to kind of be open about your feelings and to actually think about it. If anything, if you don't want to talk to somebody about it, then definitely journaling or just like writing down oh, this just happened. This made me feel like this. Um, can also definitely help just because keeping in your feelings definitely will eventually make you explode or just it'll overall, I don't think will make you feel that great, even though talking about feelings can be a little hard, but it overall will help your well-being. Um, so another related to community support. Um, I think fostering supportive communities and peer networks where minority youths can connect, share experiences, find understanding and empathy can definitely be really helpful, um, just because they probably experience similar things that you have experienced. And talking about that can definitely really help. Um, yeah. Another is practicing self care. So this can kind of relate to developing coping skills. Um, but I think it's really important to make time for self-care activities, making time for yourself, doing things that make you feel good, um, developing different coping strategies that you can do when you kind of are feeling, I don't know, different mental health symptoms or you're not feeling that great. Kind of understanding what works best for you is really important. Um, yeah. So different options, such as exercise, meditation, different hobbies, hiking, spending time in nature, um, anything like that. Also, being outside definitely helps. And then lastly, I would say, um, oh, you're right here. Actually, before we go to that, another thing that could be helpful would be to educate yourself as well as educate maybe your family members or people around you. If you take the time, learn about mental health and the resources available to support well-being, um, being informed can help you make better decisions about your mental health. Um, eh, Sorry, as well as kind of educating your family or people around you. Um, it may differ for people. I know personally, I majored in psychology in undergrad, so I was super passionate about mental health, and I talked to my parents about mental health, about the benefits of therapy, um, and before they had like somewhat of a stigma, not really, but more in terms of um, like they themselves kind of don't have bottled their feelings up. So I have kind of learned to, or I've just kind of lend a hand to my parents, that they can talk about it. I'm here, and I think honestly that helped like our family a lot. And I think like not all families, I guess, are like that, but if it doesn't hurt, I think it can definitely help, like educating your family a little bit, but definitely educating yourself. And then lastly, which I think is really, really important, is setting boundaries. So just learning to set healthy boundaries with friends and family. It's okay to say no to things that may overwhelm you. And yeah, in order for you to prioritize your well-being. So, yeah, remember that taking care of your mental health is an ongoing process, and it is okay to ask for help when needed. Um, I think with that, I didn't mention this with like the peer support, but in terms of your support system, um, like reaching out to people that make you feel comfortable, that you can talk to about, your personal things, um, and like they'll be okay with that. Yeah. So don't hesitate to reach out to mental health professionals or supportive adults if you ever feel overwhelmed or need additional guidance. Um, Kind of investing in self care and support can have a positive impact on your overall quality of life. Okay. And then here, I've listed, so these are more so what can we do as like society um, to kind of help with um, minority mental health. So, first one is adding culturally sensitive and inclusive mental health services. So, these can play a significant role in providing support to individuals from minority backgrounds, taking into account their unique cultural values and needs. By fostering upon dialogue by fostering open dialogue and understanding, families and communities can work together to promote mental health and resilience among the youth. Um, Another is raising awareness and try or working towards reducing stigma. Um, so for this, promoting awareness about mental health issues and actively working to reduce stigma in both minority communities and the broader society. Um, in terms of reducing stigma, is definitely not a like small task. Um, but the little you do, and if it reaches people, then you're doing something about it. So education, open discussions, they can help normalize conversations about mental health. Um, I didn't mention this before. I think in terms of the last slide about educating yourself and I guess like raising awareness and all that, um, there are a lot of different like therapists that like post stuff on Instagram. They have different tips and all that. I think those are also really helpful because sometimes they just have posts that you relate to and kind of reading about it, learning more about what you need to do, or like, oh, these feelings, these like, I know what I need to do now to kind of control these feelings or like manage them. Yeah. Um, okay. And then the next thing that we can do is address socioeconomic disparities. So this is also kind of broad. Um, This relates to advocating for policies and initiatives that address socioeconomic inequalities, including access to quality education, healthcare, and other resources that can impact mental health being. So yeah, like advocating for different policies, like joining nonprofit groups that advocate for minority mental health, um, stuff like that. Another is empowering youth and encourage leadership. So empowering youth minorities by involving them in decision-making processes, community initiatives, and leadership roles can foster a sense of agency and value, which can positively impact their mental health. Yeah, neolth as a platform, we do have a student ambassador program where we kind of, it is a leadership position. Different students are passionate about mental health. They're part of this program, and they do empower youth. They kind of work towards reducing stigma, starting awareness, and that's definitely really important. As I don't know, if students are kind of telling you this information, it's easier to relate and understand where they're coming from. Um, Okay, and then the last thing that I have written down is create safe spaces for open discussions about mental health within racial and ethnic minority communities. So this relates to kind of creating safe and inclusive spaces where youth minorities can express themselves, share their experiences, and feel supported. Schools, community centers, online platforms can serve as such spaces, as well as just like peer support as well. So by taking these steps, we can work towards creating a more supportive and equitable environment for youth minorities, promoting their mental well-being and empowering them to thrive. It's crucial to involve youth, families, communities, policymakers in these efforts to ensure a comprehensive and impactful approach um, when talking about minority mental health, as well as youth minority mental health. Any questions, comments? Okay, let's end. Oh, okay, so um, now we're going to be, or I, yeah, we have some student stories from Neil's blog series that kind of talk about different personal experiences. So our interns and student ambassadors write different blog posts as part of their, it's like their position as part of being part of neolth. So one series that we have is called Student Stories. I just mentioned it, but basically, like our interns and student ambassadors, they just write different posts, like personalized posts. Um, so the student story series allows fellow students and interns and ambassadors to share personal experiences juggling their mental health and lends a hand to other students. So the first one here that I have is called Being the Minority. So you guys can read this. So she talks about wanting to eat regular American food at lunch since she had brought her, I guess, like cultural food, like authentic food from home, and um, seeing others kind of have peanut butter and jelly sandwiches or kind of basic sandwiches, and it made her feel a little left out. Um, so she talks about how eating regular food to fit in, and it showcases racism within minorities, and how this experience kind of like uh, she like she had always it's always been in the back of her mind, um, and all that. Yeah. Okay. Going to go to the next one. So this student story, it's called "In Their Eyes: LGBTQ plus student mental health." Um, so it talks about how being in a minority group comes with unseen struggles and challenges, and features an interview with LGBTQ plus allies on on their experiences with mental health. So yeah, as you can see, these student stories are very impactful. It helps just like our blog posts in general. They kind of lend a hand. They're very supportive in a way, but they also spread knowledge and awareness. Yeah. Overall, neolth is very inclusive and diverse, as our interns and ambassadors have opportunities to engage in different types of content, like these blog posts, talking about mental health in schools, reducing stigma, and personal experiences. Um, our ambassadors also participate in various forms of mental health advocacy, including sharing their stories, like these student short stories, to reduce stigma, educate others, and spread awareness about mental health. Okay. Okay, so now we're gonna move on to the discussion portion. So if you guys feel comfortable answering any of these questions, then feel free to unmute or write in the chat.
Hello, hi. Not sure if you all can hear me. I hope you all can hear me, but I was just gonna say, like, for number two, probably just kind of going on with the whole conversation. It's like, you know, the views on mental health, the way that culture portrays, you know, that you have to be as part of your community and culture. That's definitely been something that has been challenging. Um, like within like my family, for example, and you know, as like a Latino individual, and so I definitely feel that that resonates strongly with me, and also like the demographic of students that I work with as well. So
Thank you for sharing. Yeah. I, Aisha, Aisha. Yeah, I would definitely say that is a barrier that kind of relates to like stigma a little bit, like family dynamics. Um, yeah, it's definitely understandable. Yeah. Thank you for sharing as well. Um, yes. Thank you, Nandana, for sharing. Yes, I definitely agree. Students taking an action, talking more about mental health, I think can play a role in spreading awareness. Anyone else want to share? If not, then we can move on.
I can share. Especially, I work as a licensed professional counselor. I work in a rural clinic. I would say the barriers with accessing is it's just having spaces for mental health care in rural community settings, because there are not a lot of them. So a lot of times I'm in the east of Dallas, Texas. So there, a lot of times when I have to refer people to mental health services or more specific treatment, it's closer to Dallas. And Dallas is about an hour away from where I am. So a lot of times it's, financial, it's, actually being able to get there. A lot of places are, of course, like 8 to 5. So that's an issue as well. So those are some of the, major barriers, just right. And transportations and additionally, so a lot of parents that I work with in a pediatric clinic too. I'm sorry. A lot of the parents they'll kind of tell me, oh yeah, this resource is good, I'll drive there. But then, come maybe some weeks down the road or their next doctor's appointment, what I hear is that I was too scared to get on the road, because of course, it's fast driving down here. 75 miles an hour is pretty standard, so sometimes that induces some fear in the families, and just being away from the areas that they're more comfortable with, that presents an issue. So I would say that's a big stressor in finding, or barrier in finding, just really good mental health care for patients, especially the little kiddos I see.
Yeah, awesome. Thanks for sharing.
Sure.
Yeah, I definitely agree. Okay, I guess now, thank you guys, everyone who shared. Yeah, really appreciate everything that you guys said. Oh. Yeah, thanks, Monica. Yeah. Yeah, there's the language barrier for sure. I think nowadays there are I don't know, I forgot what it's called, but you can tell, you call a doctor's office, you can tell them that, oh, could I get a Spanish speaking provider? So I think there's ways to combat that barrier, but I think the barrier is definitely there. It's definitely prevalent. Yeah, translators. Awesome. Thanks, guys. Okay. Just as we're running out of time, I'm gonna move on. Um, okay. I have this short video explaining neolth. So I'll just play that. Let me know if you guys can't hear. So that was just a short video explaining neolth. So if you guys have any questions regarding the event, neolth, our student ambassador program, like our platform, feel free to email Christina or myself. Christina is our outreach and engagement specialist. So yeah, feel free to reach out to us for any information. Okay, so that was the end of the event and workshop. Thanks, Christina. So that was the end of our workshop. Thank you to everybody for coming out. Very happy with how it went. It was very interactive, so thank you for that. So just a few things before you guys leave. So I will be sending out a email in a few days. So look out for that. I'll be sending out a copy of these slides as well as the recording. And then I'm gonna send you guys a few links. So I'll be sending out a post-event survey, which I'll send before you guys leave. So just fill that out as soon as you can. And then if you guys are interested in signing up for our platform, so I am going to send out a link that you get a 1-month free trial. And then if you're interested in signing up for the student ambassador program, then I will send out information regarding that, like a link, as well as the link to sign up. So yeah, thank you guys again. If you guys have any comments before you guys leave, then yeah. But otherwise, you guys are free to go. Thank you again.